work as the regional coordinator for the African Sex Workers Alliance. I'm here to talk about the impact that COVID has had in the lives of sex workers. We as sex workers have faced a lot of impact in relation to COVID-19. One of the impact that we've seen as sex workers in our community is the loss of livelihood. We have lost livelihoods, and this has meant to us as sex workers to engage in unsafe sex practices. This is because sex workers need money to survive, and the donor response has been very slow. We have also seen sex workers not being able to travel from one place to another. This is because of the limited transportation across Africa. And so we as sex workers are not able to access mental health care services or any prevention tools that we need. In the long term, we also speculate that we as sex workers, because we have nowhere to go, our brothels have been closed, the bars have been closed where we stay and where we do our sex work. We speculate that there will be a rise of HIV and STIs because we are engaging in unsafe sex practices, because we can't be able to access to prevention tools or to drugs that we are used to, or healthcare services that we are used to in our facilities. Another thing that I want to talk about is you can only be paid if you're reaching out to the targets, and now with the COVID response, all the sex workers have moved. We have also seen an increase of gender-based violence because sex workers have been forced to go and live with our regular partners so that we can get a shelter and food. We have also seen a rise of human rights violations. This is because the law enforcement have taken this time. If you're got anywhere standing, or even if it's somewhere where on the streets waiting for a client, or where somebody can just guess that you're doing sex work, someone is beaten, and this we have seen a lot of increase of human rights violation. We also want to highlight that sex workers have been able to come together, and they have also done a lot of work together, like providing food. This is the time that we need support more than ever, because even psychologically most of us are tortured because we don't have money and we don't have anywhere to go. We also want to highlight that most of the money that is with sex workers is program-based. We have seen there is no emergency response when it comes to issues of sex workers. We also want to ask donors who are listening to this video that it's very important for donors to come to a rescue, because we have seen that funding that is given to sex workers is program-based but not AIDS-based. This is because we have seen very little emergency response funding for sex workers in Africa, and this is because most of the funding that sex workers have is program-based. We ask our donors to consider giving sex workers emergency response fund to be able to respond to emergencies that arise in terms of